This program has been paid for by the sponsor and does not reflect the views of PCN.
Good afternoon and welcome to PHRC Speaks, Fair Housing Forward. I'm your host, Brittany Mellinger, and I serve as the Fair Housing Training and Outreach Coordinator at the Pennsylvania Human Relations Commission. In this show, we explore all things housing with the experts, advocates, and community leaders who are working to expand access to housing. Today, we'll be discussing hoarding and housing stability. It's my pleasure to welcome to the show Courtney Owens and Gabe Halperin-Goldstein from the Jewish Family and Children's Services. Courtney Owen, LCSW, has primary responsibility for leadership of specific JFCS programs, ensures the financially responsible operation of these programs and services, and seeks new program development opportunities consistent with the mission and values of the organization. In this role, Courtney partners with program leaders and the development team in the identification and pursuit of new funding sources for program sustenance and expansion. Courtney received her MSW from Tulane University and her BS in psychology from the University of Oregon. She has over 17 years of experience providing community-based mental health and social services in Philadelphia and New Orleans. Previous roles at the organization include JFCS Director of Individual and Family Services and JFCS Program Manager for Hoarding and Care Management. Gabe Halperin-Goldstein is a clinical social worker who recently graduated from Temple University. He has spent the past year with the Hoarding program at Jewish Family and Children's Services, working with both individual clients and facilitating several buried and treasure groups. In addition to social work, Gabe has worked in digital communications, writing news stories and blogs about research in public health and business. Welcome, Courtney and Gabe, and thank you for joining us.
Thanks so much for having us. We're glad to be here.
So we all have a story about how we got to our work and vocation. I'd like to start this conversation by inviting you to share your journey to your current work.
Yeah, so my journey and how I got here into this program is after I graduated social work school, I started working in community mental health. So my role was really to work with individuals who were in and out of psychiatric facilities to help them maintain stability in their community and in their homes. And in that work, we did a lot of home visits. We worked with a multidisciplinary team. And often we would come across homes of individuals who were struggling with hoarding disorder. But our main focus was really to help those individuals maintain in the community, out of hospitals, and focus on the most present mental health symptoms that we saw. And we didn't know that much about hoarding disorder. And we also didn't know how much it was really impacting that individual. So it was kind of a thing that went unaddressed. And from that work, I was led years later to JFCS, who was starting a hoarding disorder program, and they were looking for someone who could develop that initiative that they were taking on. And I felt like it would be really interesting, and it kept me connected to services in mental health. And so that's kind of how I ended up at JFCS and started working to build what is now the JFCS Hoarding Support Program.
Wonderful. Gabe?
This work is the beginning of my social work journey. I joined JFCS as an intern when I was doing my MSW at Temple University, and I didn't know much about hoarding disorder and thought it'd be a one-year internship, but I really enjoyed the work, and it was challenging and allowed for lots of creativity, and there's still a lot that we were learning about hoarding, and so I decided to stay on after, and I ended up staying on after my graduation in May 2023.
Yeah. Can you tell us about Jewish Family and Children's Services and the hoarding program?
Yeah, so Jewish Family and Children's Services is a nonprofit social service organization, and we provide a lot of services from birth to all ages. And some of those services include, case management, counseling services, support groups. We have prevention and early intervention services, parenting programs. We have an adoption program. We have a older adult case management program. We support Holocaust survivors. So our programs really run the gamut from a lot of different resources that we can provide to individuals who call into our agency. And one of the programs that we have is the Hoarding Support Program. That program really launched in 2015 when we began developing it. And the reason that that program came to be is through the older adult case management program that we provide. And that service was case managers and social workers who were doing home visits to help the aging population age in place safely. So they were, doing safety checks in homes. They were providing basic needs support, helping people get connected to home health aides, home repairs, all of those kind of things that really make somebody able to age safely in their home. And often what they were finding was high levels of clutter that were creating safety issues, mobility issues, potentially somehow like risk of losing housing related issues in rental places. And so from there, what they were doing really was a lot of clean outs. They were calling a cleaning company because there wasn't a lot of other resources to be able to provide at that time. And so they joined the Philadelphia Hoarding Task Force, and through that sort of learned that hoarding disorder was really more prevalent than we realized, and applied for a grant. And that grant was a 3-year grant that allowed the agency to build this program. And that grant started in 2015 when I began working at JFCS. And from there, I became a really active part of the task force as well, and was able to get trained formally in recommended models for hoarding intervention that all included in-home community-based work and some support group work, which we can talk about later more of what that looks like. And so that was really the initiation and the building of the program. And once I got started, the referrals were really just kind of like pouring in. There was a lot of need, a lot of identified clients who were seeking this kind of support. And most of that was because there wasn't a lot of resources in the community that would do that in-home, hands-on work with people who were dealing with hoarding disorder. And Gabe's going to talk a little bit about what our program currently looks like.
So we have 3 main parts of our hoarding program. First is our individual in-home care management program for those with hoarding disorder. This is a program that works with people in their home and for up to 18 months at a time, where a care manager will come who's trained in the model and has a good understanding of hoarding disorder, and provide support to help that person get their home to a less cluttered place. So we'll start with an initial assessment where we learn a little bit more both about the home and how the stuff is interfering with the safety and comfort of the home, and also about the person. How did it get to this place? What makes it hard to let go of their belongings? Where are they acquiring new belongings? Using that initial assessment, we can then make a treatment plan where we break down the different goals that they have for their home and the steps that would be needed to get there, and then spend time doing sorting, doing exercises, checking in on their wellness as they execute this plan, and develop more like skills and coping strategies for managing their belongings. We also do assessments every 3 months, which measure things like safety and sanitation issues in the home, how much clutter is interfering with daily life activities, and other ways of measuring clutter more visually. So that is the individual program. In addition, we have a support group called Buried in Treasures. This is a 16-week peer support group that happens virtually and overviews a lot of different topics about managing clutter, such as how did I get here? How did this clutter accumulate? We go over the good guys and the bad guys of decluttering. So this includes the good guys being strategies that commonly work well, the bad guys, common pitfalls that people fall into when they're that don't lead to progress. We go over tools for reducing acquiring, We go over different steps of the sorting process. So how to prepare to sort, different skills involved in sorting, and then how to maintain that progress. We go over motivation exercises of how to stay motivated when things are challenging and morale is low. And then we help the members of the group stay connected after Buried in Treasures ends on their own without the guidance of a JFCS facilitator so that they can continue getting that peer support. And then the last part of our program is professional development and community education, where we provide trainings on the basics of hoarding disorder, like including its definition, prevalence and research, treatment models, and more. And we give these trainings to anyone who's interested, including mental health providers, social service providers, law enforcement, first responders, loved ones of people with hoarding disorder. And the trainings can be for different lengths depending on what the specific needs of that audience is. And we do these trainings in partnership with the Philadelphia Hoarding Task Force with the goal of creating more hoarding resources in the community and a deeper understanding of hoarding disorder from a mental health lens for everyone that hoarding disorder touches.
Yeah, that sounds like an incredible program. Before we get too deep in our conversation, I'd like to ask you if you could share a definition of what hoarding is.
Sure. So hoarding disorder is an official diagnosis in the DSM. It came out in 2015. It previously was categorized as an anxiety disorder under OCD, obsessive compulsive disorder. And then they realized that there were some really big differences between OCD and hoarding disorder. And so hoarding disorder is categorized by 5 things. One, and being the most important, is difficulty discarding. So individuals with hoarding disorder have a really difficult time letting go of items, and that can be for a wide range of reasons related to the attachment of that item. But letting go of it really can cause a lot of distress and discomfort, which is the second sort of component of the diagnosis, is the perceived need and discomfort of discarding with that item. What will it mean if I don't have this item? The memory attached to the item, the sentimentality of it, all contributes to them having a difficult time letting go of it. The third component is the accumulation of clutter that interferes with life, meaning spaces are no longer used for their intended purpose. So your living room, your kitchen, your bedroom, commonly used areas that have very specific uses are no longer utilized due to the level of clutter. And the third is that it causes distress or impaired functioning. So it can create these safety issues, relationship issues, financial issues, employment issues due to the distress and anxiety that comes with hoarding disorder. Lastly, it's not due to some other mental health or physical health condition, meaning, it's not that you're not able to, physically able to let go of the items, but there is that really strong attachment and distress when you let go of the items. And there's 2 specifiers that come with hoarding disorder, and that is insight and acquisition. So there are a lot of clients who have a hard time letting go, or people with hoarding disorder that have a hard time letting go. There's also individuals with hoarding disorder who have a hard time not acquiring. Often they go hand in hand, but sometimes you see people who acquire more, and that's really more the main focus and where we start in the treatment when we're working with folks. And also we see different levels of insight with individuals with hoarding disorder. And so we've seen statistics that are like 15% of people with hoarding disorder have insight, meaning most do not have insight into how hoarding is impacting their day-to-day functioning. And so that's also a place where we have to start and do a lot of work when we're helping someone who's dealing with hoarding disorder to help them gain that insight and realize how the clutter is impacting their day-to-day life. Hence the assessments that Gabe was just talking about that we utilize in our services. One of the things that we know about working with someone with hoarding disorder is that it requires a unique kind of intervention and mental health approach. The work being done in their home is really, really key. We're working hands-on with that person. So we have to build a good relationship with them and help them understand, why we're there and that we're on the same team and we're really coming from a place of support. But we do know that about 2 to 6% of the population are dealing with hoarding behaviors and tendencies and hoarding disorder. And so that's really the core definition of what hoarding disorder is based on the DSM-5.
Thanks. That's really helpful understanding to form the basis of our conversation. And you touched on this a little bit, but in your work, what does hoarding disorder typically look like, both in the home and the impact on those with hoarding disorder?
Yeah, so I'll start in the home where hoarding can contribute to safety hazards in the home, such as fire hazards. If there's an accumulation of papers or other things that are flammable, then a fire would spread faster. Or if those things are covering heating sources. There can be infestations. Not that there's necessarily an infestation in a hoarded home, but if there is, it becomes a lot harder to manage and deal with that infestation issue. It can lead to legal issues due to housing code violations and inability to do home repairs or basic maintenance on the home. As far as the effect on the individual, it can be, first of all, very uncomfortable to live in a hoarded home if you can't do things like cook or move around or clean areas that are getting dusty or sleep with your entire bed or find important things that you need. All those little ways that a hoarded home can interfere with daily living can be very exhausting and uncomfortable and contribute to significant stress. Stress of not being able to do those things, and then stress of having a very long to-do list of things that need to get done, but it's overwhelming to know how to start or how to get through everything. There's also often a lot of shame associated with hoarding disorder. Many people don't want to show their home to others, and this can contribute to social isolation and loss of friendships or important relationships if you can't invite someone into the home. The impacts can also extend beyond that person into the community. So some of these safety risks that I mentioned, like infestations or fire hazards, can impact neighboring houses or apartments. And then there are also costs associated with hoarding. So sometimes hospitals, when someone is in the hospital and then they realize the home is hoarded and that person can't go home, and there are costs associated with them having to stay in the hospital until the home is at a place where they can go back in. Costs associated with cleanouts, if cleanouts are needed to clean a hoarded home. And so the impacts can extend beyond just the individual person as well.
Yeah, those impacts are so wide-ranging. Many of us have more belongings than we need in our homes. Could you speak to when it's actually considered to be hoarding?
Yeah, absolutely. And it's a question that we get all the time when we're doing trainings or talking with folks in the community, because we all have stuff, right? Like in our homes and in our spaces. So there are a few questions that we sort of outline that you can ask yourself to say, is this just that I have these belongings in my home, or when does it sort of tip into hoarding disorder? And one of those questions is, what is the reason that stuff is accumulating? Is it because I'm having a hard time letting go? Or is there another reason? Like I'm too busy to clean, physical disability is preventing me from cleaning. Like what is the reason that the stuff is accumulating? And when we find that answer, then maybe we can dig in a little bit deeper to help understand like what is the real need here and how can we provide support? The other question is the stuff interfering with how my home is used, contributing to a lack of safety or causing significant distress? So this is back to spaces are not able to be used for their intended purpose, right? Like if that's something that you're getting to and that you're noticing in your own home, that would be an indicator that it could potentially be hoarding behavior or hoarding disorder. And that's really one of the biggest things is why are letting things go difficult, and are the amount of clutter impacting you from using your spaces for their intended purpose? And those would be the two main indicators that would help you realize that. We also have an assessment tool that we use, and it's widely available called the Clutter Image Rating Scale. And it shows visuals of pictures, and that tool is able to help folks say, like, where are you on this scale? And anything that would be a 4 or above on those pictures would let you know that maybe there is more support needed to help this person.
Gotcha. So how does the stigma around hoarding disorder impact folks who are trying to get help?
The stigma can impact people in a few different ways. First, there are many misconceptions about people who are hoarding, including that they're lazy or dirty or that they don't want to change. And while it may seem like that, sometimes, often what's happening is that the person may have tried before and not had success, or not known how to go about overcoming their clutter. And so it's not that they don't want to change or they're lazy, but that they don't necessarily have the tools to get where they want to go. And in addition to these misconceptions, there are some negative connotations attached to the word hoarding. So, for example, you might be familiar with the TV show Hoarders. And while the show does raise awareness of hoarding, it can sensationalize the issue and portray the intervention in a way where that person who's hoarding doesn't really have much say in what's happening and what stays in their home and what goes in their home. And so the combination of these connotations and misconceptions means that sometimes when people do ask for help, it doesn't go well. Maybe they have people who come in and just encourage them to throw everything away at once, or make them feel ashamed about their inability to overcome their clutter. And that can result in damaged relationships with those who are trying to help. If someone's experienced something like this, then they may choose not to reach out for help in the future for fear that it will go the same way, or they'll be judged. And so this is a big barrier for people who are trying to reach out for help, is that fear of being misunderstood. And then beyond that individual level, the stigma can impact hoarding supports on a macro level. So if we don't know how to assess for hoarding, it's not something that's commonly assessed for. So many providers may not assess for it, may not realize that hoarding is impacting their clients or their patients. And then even if hoarding is identified, many areas lack the referral sources or the resources necessary to meet the need of their population. And so those who are identified may not have a community-based model of hoarding intervention to turn to.
Yeah, thank you. Could you speak to how hoarding disorder can impact someone's housing stability?
Yeah, absolutely. There are a handful of ways that hoarding disorder can impact someone's housing stability. One way is it can be hard to do home repairs. So if somebody is in need of any sort of home repair or just preventative maintenance type of work, might not be able to get done. Part of that could be because of shame or fear that the person is unwilling to let others into their home to do the work, or to even realize that the work needs to be done. And that can create real safety issues, especially for folks who are, aging in place. And so we want to make sure that the home we're able to get in and do those home repairs. The second is infestation or sanitary conditions may impact individuals, but also people that live around them. So someone in an apartment building, those things could, go into other apartments or impact the quality of life of other residents in those units. Or row homes, any sort of shared living environments. Although we do want to note that not all hoarding situations are unsanitary or have infestations. However, the increased amount of clutter can make it hard to treat for pest management, and can also lead to just increased dust or things like that, because you can't clean around the levels of clutter. One of the really significant issues is it can create housing code violations that lead to fines for that person. It can be really fearful that some other enforcement agency is going to come in. Am I going to be removed from my home? Therefore, preventing somebody from even wanting to seek out support. So fines and dealing with, city code violations can be really challenging. It creates distress with neighbors and other people who are living around them. And also, if someone's in an apartment or a rental unit, it can lead to like lease violations all the way up to evictions. And we've seen this a handful of times where we have folks calling us because they're being evicted due to hoarding disorder. And we have to step in. And that can be really detrimental to somebody, especially if they're not able to afford to move or find alternative housing. The last way that I'll mention is that some individuals we see, it can lead to just financial distress where people might end up having multiple storage units or things that they have to pay for monthly. And, then it becomes a choice of, do I pay for the storage units or do I pay my rent or do I not eat or, things like that because the increased costs and fear of losing their items. And so these are things that we see commonly in our program.
Yeah. We're nearing the end of our time today, but I'd love to ask you to briefly share about how housing providers and tenants both have roles to play in resolving hoarding situations in rental housing. Are there any best practices for housing providers to ensure a successful outcome for both parties?
Yeah, there are a few best practices that can help the housing provider working together with that person who's hoarding. First is having consistent inspection standards, so avoid scheduling inspections and then not showing up, which can cause a lot of distress for that person who's waiting for the inspection. And then on the flip side, avoiding impromptu inspections without reasonable notice. Another big one is having concrete guidelines on what constitutes a safe home. So oftentimes housing providers might say the home needs to be less cluttered or safe and sanitary. But these terms can mean different things to different people, leaving someone unsure when they've met the guidelines. And so more concrete guidelines like having 3-foot pathways or stacks of things no higher than 4 feet or doors able to open for first responders can help make everyone on the same page of what the goal is. And then the last two I'll quickly note are taking note of the progress, even if small. And then last is emphasizing safety first as the main priority more than the belongings and making sure that concern for safety is first.
Yeah, I can imagine how that clarity and that focus on that relationship can really help both parties move forward. I could talk with you both all day, but we are just about at the end of our time. Could I ask you to briefly share about what keeps you going on challenging days? I know must be very challenging work, but also really meaningful work. So what keeps you going on those hard days?
For me, I think that I used to feel discouraged sometimes when it was hard to see progress in the clients I was working with, but learning that there are so many ways to measure progress, whether it's someone letting go of something they never thought they could, or someone letting someone into their home for the first time in years, or someone, maybe their home doesn't look like the cover of a magazine, but they've been able to clear a pathway in their home and that's made it more safe. And so, finding those other ways to measure progress.
Yeah, and I would say that, for me, when I first started doing this work, someone told me it's like taking 1 step forward and 2 steps back every time. And I think that holds true, but that 1 step forward is really, really impactful. And you see the benefit and the partnership in that. And it's really a great thing that keeps you motivated. The other thing I would mention is just the partnership. To do this work, we really do build a team for everyone that we serve, and partnering with community organizations and services is really a cool thing and has allowed us to do and create a lot of innovation around the work. And that's been really great.
Well, Courtney and Gabe, thank you so much for the work that you do, and thank you for taking the time out of your busy schedules to come on the show this afternoon. We're really grateful to have learned from you this afternoon. I'd also like to thank our viewers for spending their afternoon learning with us. If you believe that you've experienced housing discrimination or would like to learn more about housing protections in Pennsylvania, give us a call at PHRC's Fair Housing Line, which is 855-866-5718. You can also find us at our website on the screen, which is pa.gov/en/agencies/PHRC. You can also keep up with our work on Facebook, Instagram, X, YouTube, or LinkedIn. And remember, our communities are stronger when everyone has a place to call home. We'll see you next time.
This program has been paid for by the sponsor and does not reflect the views of PCN.